I am at the nurse's station performing my second med check. I've got 3 meds to give my patient this morning. So first I'm going to perform hand hygiene. And I'm going to go ahead and get my meds ready. So I have them already pulled, ready to go. So I've got Mr. Ferdinand Foley in room 211, date of birth 9/23/69. He has an allergy to sulfa. He has ordered fluticasone propionate 100 micrograms and salmeterol 50 micrograms, Advar discus inhalation powder 100/50, 1 inhalation BID to be given at 0800. I'm going to verify that with what pharmacy sent me. Pharmacy sent me fluticasone propionate 100 micrograms and salmeterol 50 micrograms, Advar discus inhalation powder 100/50, 1 inhalation. This is the correct dose as ordered, so there were no drug calculations needed. This has an expiration date of January of 2020, so it's within its expiration date and good to give, and as stated, it's going to be given at 0800. The second medication we have ordered for Ferdinand Foley, date of birth 9/23/69 with an allergy to sulfa, is acetaminophen Tylenol elixir 650 milligrams POBID for arthritis pain. This is ordered to be given at 0800. I'm going to verify that with what the pharmacy sent. And I've got acetaminophen Tylenol elixir 325 milligrams for every 5 mils. Since this doesn't match what was ordered, I did drug calculations. Mr. Foley is going to be receiving 10 mils of this medication. This has an expiration date of January 2020, so it's within its expiration date, and it's going to be given at 0800. The last med ordered for Ferdinand Foley, date of birth 9/23/69 with an allergy to sulfa, is diltiazem hydrochloride practicardin 180 milligrams PO daily, and this is to be given at 0800. Pharmacy sent me practicardin 180 milligrams. It's 1 tablet, so this matches as ordered. There were no drug calculations needed. This has an expiration date of December of 2020, so it's within its expiration date. And so that is correct, and we'll set that right there. Since we're at the nurse's station, I'm going to go ahead and prepare my elixir here. So I'm going to go ahead and shake up my bottle really good. I'm going to take the cap off, set it up, place my palm on the label. I'm going to get it eye level, and I'm going to fill my cup up until the meniscus is at the 10 mil mark, and it is. So then I'm going to go ahead and wipe the lip of my bottle with a tissue, place the lid back on. This is a unit dose container. It won't go in the room, so it'll go back in the med drawer. And because of that, I have to make my own label, so I have my label here, but I'm going to go ahead and write acetaminophen Tylenol elixir 10 mils, the time 0800, today's date January 20th 2019, and my initials. I'm going to go ahead and tape that to my cup, and then I have another medicine cup for the Carzem. So before we go, I'm going to go ahead and perform my third medication check for my elixir because it's a unit dose medication. So we have Ferdinand Foley, date of birth 9/23/69, an allergy to sulfa. What was ordered was acetaminophen Tylenol elixir 650 milligrams POBID for arthritis pain, due to be given at 0800. I had to do drug calculations, and Mr. Foley is going to be receiving 10 mils. So I have acetaminophen Tylenol elixir 10 mils for 0800 for today's date, which is January 20th 2019, my initials. And I'm going to get at eye level one more time and ensure that that's at the 10 mil mark, and it is, so this is all correct. Since I have all of these medications prepared, I'm going to go ahead and sign my name at the top, and I'm going to initial by each by the time of each medication I'm giving. So these are be given at 0800, so I wrote my initials by 0800. And now we're ready to go give these to Mr. Foley. I am entering the patient's room. Knock, knock, knock. I'm going to perform hand hygiene. Good morning. My name is Samantha. I'm going to be your nurse today. Can you verify your name and date of birth for me? Ferdinand Foley, date of birth 9/23/69. That matches Mr. Foley's bracelet. and it matches my MAR, so everything checks out. I'm going to go ahead and scan his bracelet. Beep. Mr. Foley, do you have any allergies? And Mr. Foley states he has an allergy to sulfa. That matches his ID bracelet, matches my MAR, so everything looks good there. Alright, as stated, Mr. Foley, I've got 3 medications for you, okay? So before I give these medications, I've kind of already prioritized what I'm going to give. So first I'm going to give his Practicarzin. Alright, Mr. Foley, so Dr. Smith ordered Practicarzin. This is your medication for your high blood pressure. Before I give this medication, I'm going to go ahead and obtain a current blood pressure, and I'm going to go ahead and obtain a current heart rate. So current blood pressure was 160/84 with a heart rate of 80. So it is okay to give this medication. So I'm going to go ahead and perform my 3rd medication check. So what I have ordered for Ferdinand Foley, date of birth 9/23/69, is diltiazem hydrochloride Practicarzin 180 milligrams PO, ordered for 0800. And I have Practicarzin 180 milligrams, and I have 1 pill of that. That matches. So I'm going to go ahead and scan my med. And I'm going to go ahead and carefully push this into the medicine cup without touching the pill. And since he's taking a pill, I'm going to make sure that his head of bed is at least 45 degrees. I want him in a high Fowler's position so that he doesn't get choked up on this. So with my medication here, I'm going to go ahead and give that to Mr. Foley with some water, at least 60 mils of water, so he doesn't choke. Mr. Foley took that. So I'm going to go ahead and mark through that 0800 time on my MAR, so I know that he took that. Alright, next medication I have for you, Mr. Foley, is your Tylenol elixir for your arthritis pain. Are you having any pain this morning? Mr. Foley rates it a 7 out of 10. So I'm going to go ahead and just double check my what was ordered. So I've got Ferdinand Foley, 9/23/69. Ordered as a Tylenol elixir, 650 or 10 mils as we calculated, PO for arthritis pain at 0800. So on my label, I've got my Tylenol elixir, 10 mils, the time of 0800, today's date, and my initials, so that matches. We've got 10 mils in there. I'm going to go ahead and scan my med. Beep. Give that to Mr. Foley. I'll let him get a drink of water after that because it has a bad taste sometimes. So I'll throw this med cup away with all my other trash, and I'll take this label and I'll put it in a HIPAA bin. That way we're not violating patient rights. All right, Mr. Foley, 1 more medication for you this morning. So I've got your Advar Discus. Would you like to take that? Mr. Foley does not want to take the Advar Discus this morning, so I will go ahead and return this per policy to the Pyxis. And I'm going to go ahead and circle that medication and just put patient refused because he doesn't want to take it. And since I'm doing that, I'm going to go ahead and mark through my 0800 for my Tylenol elixir. All right, so now that my meds are given, I'm going to go ahead and make sure Mr. Foley's bed is in a low locked position. Both side rails are up. Call light within reach. I'm going to make sure he doesn't have any other needs to be met, and he does not. So I am going to go ahead and take this medication back to the Pyxis. I'm going to perform hand hygiene. Mr. Foley, you call me if you need anything, okay? And then my time is up, and this is my medication, my MAR. This is what it looks like. I have my drug calculations signed, and then right there, signed up the top.